Hi everyone, my name is Tafora Bono. I'm a family medicine resident. I'm currently in my second year and I'll be discussing is it flu or is it COVID 19? So, a lot of this information I gathered from the CDC as well as the Illinois Department of Public Health. So, this is just an outline of what the presentation will cover. So, we'll be going over descriptions of both the flu as well as COVID 19. And then we'll also discuss transmission, signs and symptoms, complications, preventions, as well as treatment. So we will begin with discussing influenza, also known as the flu. So this is a virus, and a virus is a type of infectious agent that needs a host in order to spread. So And for the flu, there are multiple strands of the flu, and it's the most common ones we see yearly are type A and type B, and they're responsible for most of the flu epidemics that we have currently. So the flu is a very adaptable virus, which is why it's able to, which is why we experience different variations yearly, and it's also transmitted from animals to humans. So genetic alterations can be made within the virus to go from animals to humans. And most of the animals that we see, or the more common ones, are ducks, chickens, pigs, whales, horses, as well as seals. And the flu, if you can remember back to 2009, we had a major flu pandemic during that time. Next, we are going to discuss SARS-CoV-2 or COVID-19 as we are currently experiencing. So this as well as a virus. So once again, a virus is a organism that needs a host in order to spread. So there are four main types of COVID viruses. So there's alpha, there's beta, there's gamma, and there's delta. The most common ones we see that infect humans are alpha as well as beta. So just similar to influenza, COVID has the ability to be transformed from animal strands to affecting humans. So with a genetic alteration, and we are currently experiencing a pandemic with COVID 19. So, next, we're going to discuss the transmission of both of these viruses. So, we're just going to start in the middle. We're going to look at uh, the similarities between the two of them. And then on the left column, we go a little bit further more into flu. And on the right column, we will discuss COVID 19. So, for the similarities, both of these viruses are transmitted from person to person, and which is why it's important to the 6 feet distancing. It allows for space in order to prevent transmission from both of these viruses. So, and both of these are spread by droplets. So, typically, when someone coughs, when someone sneezes, when someone talks, uh, and just the small particles that come through saliva is able to um, get onto someone else, and the viruses are transmitted in that manner. So it can also be transmitted from, so let's say, coughing on your hand and touching a surface. The viruses are able to last on a surface for a certain amount of time, and it varies depending on what surface is being touched. But if someone does have the virus and does touch a surface, someone who does not have the virus can contract it by touching that same surface and rubbing their mouth, rubbing their eyes, or even their nose. So that's another way these viruses can be transmitted. So next, the viruses can be spread at least 1 day before symptoms present. So if someone may be infected prior to them even showing any signs of an infection, these viruses can typically be spread. So looking at the flu, so we'll turn our attention to the left column. So for the flu, it's contagious 1 day before symptoms present, and it's contagious about a 7 day period. So after the person starts showing symptoms, the person can spread the virus for 7 days after that period and 1 day before. And typically, the flu it's seen more frequently in children, and then the next set of people that's seen more often is adults, and then older people, so greater than the age of 65. They tend to we tend to see less frequencies of flu incidences in them. So for COVID-19, it's contagious for longer periods of time compared to the flu. And you can actually see about 2 days before a person starts showing symptoms, they are able to transmit the virus to somebody else. And this may actually last for 10 days after they begin to present with symptoms, so which is significantly longer from the flu. So you're looking at about a 12-day period, which is why it's so important for that 2 week quarantine to happen, because it allows for that person to go through that contagious period. So also it's quick and easier to spread. So this is deemed as a super spreader, as which is what we're seeing. As you know, we have not completely rid ourselves of new cases, and we are actually seeing an increase in cases at this point in time. And also it's easier to spread COVID-19 in a group setting compared to the flu. So let's say if you have a group of 20 people, um, COVID is more likely to be spread within that group compared to if someone was infected with the flu and was in the same group. You may not see as many people infected with the flu. So signs and symptoms. So both of these present very similar to each other. So common symptoms are fevers, cough, as well as shortness of breath, fatigue, or just feeling really tired and just feeling not feeling good at all. So sore throat is a common symptom, as well as runny or stuffy nose, muscle pains, muscle aches, a headache, and then also vomiting and diarrhea also presented. Some things that are a little bit different for the flu. So the flu can either present very mild or very severe, and also can have symptoms about 1 to 4 days after being infected. For COVID-19, we seeing also people presenting with these same symptoms as well as lots of taste. There are actually some incidences where people that's all that they may have is just a loss of taste, and then also we're seeing loss of smell as something different from the flu. And like I mentioned prior, about 2 to 14 days worth of having these symptoms, and typically people average about 5 days of presenting with these symptoms. So complications, similar for both of these. You can have lung infections, which include pneumonia or respiratory failure. And this is something that we're hearing quite a bit, and which is something that is well, I guess I'll go into a little bit more detail when I talk about COVID. But yeah, you can have pneumonia or respiratory failure with both of these, as well as acute respiratory distress syndrome, which is pretty much your lungs being filled with fluid because of the inflammation that happens from being infected. So you can also have infections of your heart, where you can have cardiac injuries, so including like a heart attack, and you can also have stroke, and these are very severe cases. So you can have generalized symptoms. Once again, like I mentioned, stroke. You can have multiple organs affected. So as well, yeah, you can have multiple organs affected or multiple organ failure. You can have worsening chronic medical conditions. So someone with asthma, someone with COPD, even patients with diabetic can have worsening symptoms. So inflammation of heart, brain, or muscles, and then you can also have secondary bacterial infection. So along with these viruses, you can also be infected with bacteria. For the flu, complications. So typically recover in a few days to less than 2 weeks. So flu just has better outcomes compared to COVID-19. Whereas for COVID-19, you can have blood clots in veins as well as arteries, as well as in the heart or brain, which make this virus infection so much more severe than the flu. And then also you can have multi-system inflammatory syndrome in children, which is also a very severe process that happens in children, and it can actually lead to death. And kind of going back to the initial point of lungs, the way COVID-19 is able to affect the lungs, you see more of the respiratory failure, more of the acute respiratory distress syndrome in COVID-19, which is why you're hearing about patients having to be on ventilators. And it's just so much more severe compared to the flu. So, prevention of both of these infections. So the more important things are the hand washing. So this helps to just get rid of the viruses, especially on your hands, which typically it's we easily and unknowingly put our hands on our face, so either rubbing our mouths, rubbing our eyes, or rubbing our nose. So just making sure getting into the habit of frequent hand washing. So wearing a mask is also a very important strategy. So especially it helps you not spread the disease to someone else, because the mask does a good job of catching your droplets from your mouth as you speak, as you cough, as you sneeze. So it's a great way for you to prevent spreading it to others. And then also it does protect you to some capacity from catching the disease, the catching the infection from somebody else, just because it does protect your nose and it does protect your mouth. It's not 100% in protecting you from infection, but it's definitely better than nothing. And then social distancing, like I mentioned before, most of these. So in order to spread the droplets, you need to be within 6 feet of a person. So with staying away, with staying 6 feet apart, it makes it a lot harder to spread the infection. And once again, once you combine this with mask wearing, it even decreases the likelihood of spreading the infection. And also social distancing, just whether it's just not being out and about. Just in doing that way, you are less engaging in with other people, and once again, just helps reduces the spread of these infections. Staying at home when you're sick. So um, prior to all of this happening, it was very common for people to try to power through being sick, and whereas in this case, we that's something that you shouldn't do, just because of the severity of the infection of both flu as well as COVID-19. And then also frequent cleaning of surfaces, so especially at work, especially at home, just making sure that you're frequently cleaning, especially if you do work in an environment where you are working with others, and so that helps disinfect those surfaces and helps kill both of these vaccines. I mean, both of these infection viruses. So looking to the left, so just looking at flu. So we do have flu vaccines, and these vaccines tend to protect 3 to 4 of the flu strands that we commonly see. So it's a great preventative strategy, and it's something that unfortunately COVID-19 does not have, and it's currently a work in progress. So, and something that I would highly encourage everyone to do is go get a flu shot, because as of right now, studies have not shown that you cannot be infected with both of them. So just because you may have one of them, does not mean you cannot also get infected with both the flu as well as COVID-19. And the impact of having both of these infections will more than likely be a lot worse than having just one of them. So if you're able to prevent getting the flu, that would be a major advantage for you, or benefit for you, because once again, being infected with both of them can be very disastrous and very complicated. So, looking at treatment for the flu, there are antiviral drugs that can be provided, and but most of these drugs are provided by medical providers, so you would have to get a prescription for them. And an example of one of these is Tamiflu, which and they have to be taken within a certain time period for them to be most effective. Um, to treat both of these, typically it's just supportive therapy. So if you have a fever, you would take aspirin, or you can take Tylenol in order to help address the fever. If you just have cough, runny nose, you can take different items to help with that as well. And then also if you are, and then also a lot of fluid intake helps with with um, while sick with either of these. So for COVID-19, there is no one specific treatment at this time. So it's still something that is being explored, and a lot of studies are being made in order to try to arise to a vaccine as well as possible treatments. So just kind of going over the importance of why this is such an important topic. So the impact of flu. So about 8% of the population tends to contract the flu every single year. Within the past flu season, so from 2019 to 2020, and typically flu season starts around like September and ends in March. So there were about 38 million cases of flu infections, and then the deaths were about 22,000 deaths. And actually, that should be from 2019 to 2020. So my apologies about that. And then as far as the COVID-19, which is what we're seeing. So looking at more local pictures, so in Peoria, there's about 4,485 percent of cases. So this is at about 1.2% of the total cases in Illinois. Deaths so far, we have about 70%. In Illinois as a state, the total number of cases is 374,256, and the deaths are about 9,505. So a lot of deaths. And on a national scale, so number of cases is 8,553,827, and the number of deaths are 224,221. So a lot of people have passed away, and this is ever since January of this year. So we can see the severity of COVID-19 and how it's impacted our overall communities on a local scale, on um, on a national scale as well. So a lot of the resources I was able to gather for this presentation today, from the CDC as well as from the Department of Public Health, um, here in the state of Illinois. So I just want to thank you guys for the opportunity to go over COVID as well as the flu with you. Um, yeah, thank you and have a great day.